So it's okay. I'm going to start again, and I'll just edit out the first part, that's the only thing I know how to do. Okay, let's start again. So, hello everybody, and welcome, Angelo.
Hi, Wendy. How are you? Thank you for having me on this platform today.
I am so glad that you're on because you have so much information that we all need to hear. So let me just explain to everybody who you are and why I thought it was important that you come on. So Angelo Zissis, I hope I'm saying that correctly. You're a clinical pharmacist and you have a Doctor of Pharmacy degree. You've also been practicing as a pharmacist for 11 years in New York City. And what I love about you is you have so much knowledge about all the multiple disciplines of healing. And we work with a lot of people with acute and chronic diseases, and you really are an integrative, holistic pharmacist. And can you explain to everybody what is an integrative pharmacist or a holistic pharmacist?
Sure. In integrative medicine, we like to use modalities of East and West, basically medication, traditional medicine, as well as alternative therapies to kind of help bring the body back to a balance. Because I am also an advocate of traditional medication. However, it does deplete your body of nutrients that you need that are a necessity to keep everything functioning properly. Sometimes, though, you can get away with utilizing alternative medication to assist you that's much gentler and more natural to your body, rather than putting in chemicals that are unnecessary.
Right, so it's the balance. You know, they both have value, and I love that about you and the thing that is so brilliant, you have knowledge of both, which we're going to get to. But I know you've had your own journey with COVID, and you actually got it. And so, can you tell my viewers what happened and how you got it and your process with it?
Sure, it was a terrible ordeal, to be honest. But you know, if you're healthy and you build your immune system properly, you can get through it, even for people who are immune compromised. What I experienced, I had basically all the hallmark symptoms: fevers, chills, body aches, body pains, loss of appetite. I had a loss of all my senses, and it was a little difficult, but I had to push myself to take some of these supplements that I had put together theoretically as a pre-exposure, during the actual virus itself, and post-exposure. So I'd like to share my knowledge and my experience, see if maybe it'll help some of our viewers here today.
Yes, definitely. So I know I had spoken to you during the week, and you told first of all, how did you feel when you started getting it? And then did you know straight away, or were you tested?
Well, my first experience with it, I would say a week before I was actually diagnosed, I had a little bit of what was considered like a stomach flu. Everybody thought it was a stomach flu. I was throwing up a few times. I had a low-grade fever, 101, 102. I'd say 3 to 4 days after that, my fever started spiking. I hit levels of 105 and even 106 when I got diagnosed.
Oh my God.
I was shaking uncontrollably, and I felt all these sharp pains in my body. And I said, maybe these aren't symptoms they're displaying, but I still need to go get tested because I'm exposed around a lot of patients and my family. Even though I was masked and gloved, which were the recommendations at the time, still, I think to some degree, once you're exposed, because at the time, patients were coming from all over the world to see us. Yeah. And we service a lot of international patients, and they're traveling through airports and they're carriers. Because you're masked and gloved, it kind of reduces the exposure, but at the same time, I think you can still contract it because you're not as open-minded to little things that someone may touch, or the money they give you, or a credit card. You don't think that you got to constantly wipe and clean your hands right afterwards. Sometimes, you know, these little simple practices, we miss them, and it's very easy to contract it that way. So after I had these, I got diagnosed. I self-isolated and self-quarantined myself in a room more than the 14 days because I was a little iffy if they actually know that it's only 14 days, if there's any kind of viral shedding post the 14 days. So I extended that to about 21 to 24 days.
Wow.
My family and network, just as a preventative measure. So on that end, I also was, through my peers, we came up with this regimen of supplements that would really, really help as a preventative measure so we wouldn't get exposed. And if we do, to kind of amplify our immune system, our innate immune system, to kind of combat it before it becomes a severe crisis in our body. And from there, basically, I just hydrated properly because for some strange reason with this virus, you're very, very depleted of hydration. I mean, I even fainted at some point where the ambulance came and checked and my heart rate was severely low after I came to my senses. So the one key thing was hydration that I didn't actually follow. And I usually drink about 1.5 liters of water a day. And I don't think that's adequate enough while you're undergoing or going through this virus.
So what is adequate, love? What would you recommend?
I would say about 3 liters a day. It sounds like a lot, but I would
Okay.
double what I was taking just to be on the safe side.
Oh my God, Angela, I can't imagine that you fainted and your wife and child are there and your fever goes to 105. I mean, I've never even heard of such a high fever.
Oh, I forgot to mention though, at the same time, when I got tested, uh, they had a presumed viral, well, they couldn't see if it was viral bacteria, but there was a pneumonia present. There was infiltration in my lungs, in the bottom half of my lungs. So at the same time I'm fighting this virus, I also have pneumonia. So it was slightly different, but I think at a higher degree from some of these normal symptoms that people may experience. And to be honest, my heart goes out to everybody who's undergoing this because it's not an easy thing and we shouldn't take it lightly. It could be very, very severe.
Yeah. So when we spoke the other day, you had explained three different strains, which I didn't understand about the virus. Can you explain about those again?
Sure. There's three possible mutations that they're saying.
Okay.
One is basically low-grade fever or a little cough. The second one they're saying presents itself with pneumonia like I had, high fevers, body aches, body pains. And the third one is very, very uncommon, but they're saying that they, meaning researchers and scientists, are that there could be asymptomatic people carrying it where post the 14 days they experience slight fever or erratic tastes or smell or things that are just abnormal to their normal everyday life. So they're kind of staging into three different mutations. However, it's still mutating as it goes from body to body, person to person. So there's no real hallmark symptoms, I could say at this point, where anything that's abnormal on a daily basis that you don't normally feel or exposed to, it could be that you have or have carried this COVID-19 virus. However, fear, on the other hand, can also bring about some of these symptoms. So it's best to just stay safe and follow the protocols that they're giving us for social distancing, gloves, masks, washing your hands, just to prevent this virus from spreading to other people.
You're so right. And I know with myself, I mean, even if I get a little headache or a tiny little cough, I'm like, oh, have I got COVID? It's we all, that fear is just right there on the surface. I mean, I don't know about you, but I'm not sleeping great. I have these weird dreams. So definitely we all part of this, collective consciousness and of this fear that is going on. And it is work to change your thoughts and to change your mind and get yourself into like a more positive place. But it's amazing, your story, 105. Okay, like that's unheard of. Like, I don't even know. It's crazy.
Well,
So did you think at any point, oh my God, I'm going to die? Like, did you actually have that thought?
I had actually, the thought did cross my mind. The pain was severe. I don't want to frighten anyone, but it was very severe at times. It was restlessness. I still, to this day, think there's some kind of post-symptomatic exposure where sleep is one big key thing. What's ironic is I never had a cough actually during the virus, but I'm about a month and a week out, and I've developed like a mucosal producing cough. Which is normal.
Wow.
Apparently, they say it's a dry hacking cough. which isn't mucus producing. And it's beneficial for the actual mucus because it's getting things out that shouldn't be there.
Right.
So with that being said, there's a lot of unknown things still going on because this is such a novel virus and things are still undergoing research. So I believe that me expressing how I went through this and my insights could help other people
I
and kind of
completely
maybe reduce their fear to some degree too.
Yeah, I completely agree with you, and that's why I'm so grateful you came on to share it, because no one could have gone through this in a way that you did. It's such a scary journey, and you do have a wife and a young child, and so it's even scarier. But let me just ask you, like, can you tell, what did you do? Were you on any medication, or did you use just a holistic approach to get better? What actually did you do to recover to the point you're at now?
Well, I did actually take one medication. The doctor that did my x-ray at the diagnostic center, I didn't go to a hospital because I feared that I would get worse.
Sure.
Basically, it was like an urgent care. They put me on Levaquin just to make sure that the pneumonia doesn't really take over my lungs, and I have basically like a respiratory or acute respiratory syndrome where my lungs may shut down because of all the inflammation in my lungs. So I did that, and along with the supplements I was taking before, I kind of increased their dosing while I was undergoing this and introduced some new ones that I knew would help. And it was very difficult because I had no appetite and I had no urge to intake anything, but I had to push myself a little bit. And I saw that it really helped me, I'd say 3 to 4 days into the treatment.
So when you're saying push yourself, like you had no appetite, what did you eat? And what do you think helped you when you were eating?
My wife, luckily that she's an amazing chef, she made some soups and would leave it at the door for me. Or
Oh,
my son would bring and put notes under the door. That really helped push me.
oh,
Because
yeah,
it's hard. I think the hardest thing of all this was just being away from them and not being able to hold them and hug them and kiss them. That's very difficult,
yeah.
especially when you have a very loving family. It's hard, but they helped me, and I just wanted them to have minimal contact as well, just to prevent them from contracting this, because it's not a fun thing to go through at all.
No. So, okay, so now the soups, I understand, the Levaquin, and when the supplements you were taking, what, I know you made this concoction and I would love to share it. You sent it to me also, and I instantly, got on Amazon and ordered everything that you suggested and different vitamins. And so what is this concoction that you've come up with? And is that what you were taking that you feel like it also helped you?
Yeah, for sure. I'll go through each one. So this one give you like a brief synopsis of how each one works.
Great.
This is all theoretical, of course, but I believe that it definitely helps because we've used it for previous flus or viruses as well. So this one just behaves a little bit differently than your standard virus, only because of how it's formulated and because we don't know much knowledge about it. Now, one key thing, though, I have to discuss first is a lot of people have pre-existing conditions or comorbid conditions. So say definitely check with a healthcare provider just to ensure that it's safe for them.
Yeah.
The first and key most thing, I know it's been mentioned vigorously on the internet and on the TV, is vitamin C. However, the one key thing that they're not mentioning is to make sure that it's a buffered form of vitamin C, because it's very gentle on the stomach and you will be taking high doses of vitamin C. So with that being said, the buffered portion of it makes it a lot more gentler, doesn't give you any kind of gastric distress, and it's a lot easier to absorb in case you do need to go to these higher doses.
Okay.
So basically like a buffered C, anywhere between 1,000 to 1,200 milligrams twice a day prophylactically is the recommended dose. Another key supplement, zinc. However, with zinc, this virus is actually hijacking the actual cell and preventing zinc from getting into the cell. So with that being said, you would need to take zinc in something called the ionophore, which helps bring the zinc intracellularly into the cell to kind of dismantle this virus or the RNA of the virus before it can replicate. So with that, zinc by itself won't really get into the cell. So you want to introduce something called quercetin, which they use for allergies or inflammation. very, very beneficial taken together. And it will help zinc kind of open that pathway to get it into the actual cell and treat the virus. Now, another key thing would be selenium in the form of selenomethionine. That has been tested on previous coronavirus and SARS treatments in the past. That helps basically break down the virus before it can actually replicate. So kind of prevents the shedding of the actual virus to other healthy cells. Two other ingredients or supplements that people have not mentioned, which are very, very vital, is beta-glucan, which comes from Saccharomyces cerevisiae. This also helps prevent viral replication. So it breaks down the shell of the actual virus and prevents it from actually replicating within itself and affecting other healthy cells. Another key one is humic acid, which comes from the soil. Basically, these viruses have these adhesive layer on the outside, and they need a host cell to bind to in order to affect it and basically become viral in there. So by dismantling this adhesion layer that's on the actual virus itself, you can prevent it from attaching within your body. So those are the key, I'd say, 5 supplements that are more for pre-exposure. Okay, just in case you come into contact with anybody, or in the long run, they'll help minimize your actual exposure to the virus within your body. Now, once you start experiencing any kind of cough, usually my go-to would be something like colloidal silver. However, colloidal silver doesn't really have much viral activity. So in this case, propolis, which is basically taken from beeswax or bee saliva. It doesn't sound great, but it's got high potency against actual viruses. So you take like a propolis spray in your mouth. I do it about 3-4 times a day, and it suppresses my cough. So I know most of these stuff I've tried on my own, so I know how they work and on several of my patients. And I check in with them daily. I know there's this extensive list via email or text, and so far we're all doing great.
Incredible. And I'm going to share, thank you, because I'm going to share that recipe, that concoction. I'm going to put that out, on the bottom of the screen. But I'm so happy that you're on the other end of this, and that you were able to go through it, and you're here to tell us the story, because I do think that your story will help people. There's so much unknown, and if we can hear a story of someone who's recovered and has used both Eastern and Western and successfully got through to the other side, it's important that people know that both are important. That you've got to go to your doctor, but also incorporate a holistic approach. You need to be treated as a whole person. And that's why I love what it is that you do.
Yeah. One key thing that I also forgot to mention is when I had my pneumonia, I was scared that it would basically take over my lungs. I introduced medicinal mushrooms like reishi, cordyceps, maitake, basically a whole series of properly powdered and I'd say heat extracted mushrooms, just to prevent the kind of yeast overgrowth in our body. And that I wanted to make sure all my lung cells were nourished and properly functioning, just to prevent the pneumonia from taking over my lungs. Because I definitely did not want to go onto a ventilator, which thankful that I didn't get to that stage.
Yeah, thank God. This is such good information, love, really. And I am going to, like I said, post it, but it's scary but encouraging at the same time, because you are on the other side. But my favorite part of all of this is the love notes from your son, because it's so important, that support, like in any form, that we need. Even though you were alone and isolated for 21 days, just knowing that there was somebody who cared about you, and little thoughts that that helped to pull you through.
Yeah, absolutely. I mean, that's my life support, is my family. Yes. And I have these 2 little dogs that would come and scratch the door from time to time. But anything really helps. It really helps inside your hope to becoming better. Once you lose hope, basically your body can decline and really take a turn for the worst.
No, for sure. I've been watching, Chris Cuomo has been going through like a very public journey. Have you been watching him?
I haven't watched too much of the news because I don't want to instill any kind of fear in my son.
No,
So this, I try to read in, kind of like hit important points that I'll know for what's going on. I try to kind of keep him away from much of this so it doesn't develop this kind of fear, especially after what he was exposed to.
I 100% agree with you. But what I like about what Chris is doing is that he's using a completely holistic approach to get this, to beat this. And he is working with doctors, but he's also changed his diet and he's taking all these supplements and he's sharing that. And his wife shared that she's doing this as well for him and with him. And he said the biggest thing is like his mindset. Like the doctor called him and said, "What are you doing? Okay, get up. Like open up your arms and breathe and stretch." And you've really got to fight to, keep strong, which you've experienced firsthand.
Yeah, I agree. But sometimes when you have the severe symptoms, it's a little bit hard to do the stretching. But I will say one positive aspect was that while I was going through the virus, since I didn't have much of an appetite, I did shed 10 to 15 pounds. So that's a good positive aspect, but still, it's a sad note from what everybody are going through. It's very difficult.
So lucky, love. We're all doing the opposite. 18 meals a day. Every time I'm like eating, what am I eating next? So, Angelo.
Well, we did open up our palates to a lot of new vegetables. Like broccoli is very, very important with a little bit of garlic. Both of them have a lot of antioxidants in there, a lot of vitamin C, a lot of avocados. I mean, I've been eating avocados every day.
Yeah.
It changed my appetite, but at the same time, I felt the need to. I need to be more wiser in the choices that we have, although it's very limited because a lot of these supermarkets are not carrying a lot of things. It's pretty scary to go into a supermarket these days.
Yeah.
But I guess that's the new norm, and we have to adjust to it.
But it's important what you're saying, because there's so much we can get from food. Like you're talking about selenium, and so that's in Brazil nuts, or the vitamin C, or the E, like I think you said we can get from onions. What did you call it? The cortisone.
Onions have something called allicin in there.
Yeah.
Where allicin is a very potent antiviral, antibacterial. And it also helps wound healing if you ever apply it topically. So all our nutrients or food that's around us, they're tools. They've been used for hundreds of years. So those are your key go-to. And they help in conjunction to traditional medicine if you need to go that route, plus alternative therapies.
Exactly. Angelo, this is such good information, love. I appreciate you, sharing your story and being so brave and going through this really scary, life-threatening experience. And I'm hoping that it will help a few people just to see, there is hope. Like there's ways that you can get healed without being in the hospital. You could do this at home, but of course, as you said, you always, everyone's situation is different, and you've always got to be working with a doctor. But there is so much on a holistic point of view that you can bring in to maybe shorten this period of recovery.
Correct. You just need to help boost your immune system during challenging times, which this is probably one of the biggest challenges some of us may encounter.
Exactly. Well, thank you so much, love. And I'm glad to see that you're looking good and you're feeling good. And the 10-pound things, that 10-pound loss, that's just a bonus. And I can't wait for you to come into the cave and to see you all. But you just take care of yourself and keep getting better and better.
You're very welcome. Thank you very much, Wendy.
Take care, Angelo. Bye.
Take care, you too.